Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel, where you are seeing Ayurveda in general practice, this series. And today we are discussing or continuing the pain in abdomen topic, part 2. Yesterday, I have discussed the different causes of the pain in abdomen. And today we are starting with the treatment of amoebiasis, treatment of biliary colic, treatment of irritable bowel syndrome, and treatment of acidity. So let us move further to see the different problems. But before that, let me the screen. I would like to make a little bit broader for your understanding purpose. So here, for example, just a moment, amoebiasis or chronic amoeboma. As you basically know, there is Entamoeba histolytica. This is the name of particular organism. It you engulf with the contaminated food or contaminated, especially water, polluted water, impure water, and that gives you the amoeba or giardia type of the infections. Basically, it is affecting to the intestines as well as affecting to the liver. My dear friends, mind well, when there is two types of the loose motions. One is a watery type of the diarrhea, which in Ayurveda it is called as atisara, and another is a pravahika. Pravaha manasya pravahika. When there is a pravahan, in Marathi आम्ही त्याला कुंथणे असं म्हणतो. In English it is called as straining. When you go to the toilet, you get a very little stools with little bit pus, with little bit mucus, little bit the blood, and you have to strain and little stool comes out. So straining is called as a pravaha. Pravaha manasya pravahika gudena bahut dravasaranam atisaraha. Watery loose motions are called atisar in Ayurveda. Now this is amoebiasis is a pravahika. Chronic amoeboma is like a mass of that because of the amoebic infection in maybe liver or maybe in the intestines. Panchamruta parpati. Parpati, these are the typical Ayurvedic medicines which act on the central part of your abdomen, middle part of your abdomen, especially the intestines. The parpati kalpas are very good. Typical procedure is there. Ayurveda Shala Pune, 2 tablets 3 times in a day, Panchamruta Parpati tablet. Then Arogyavardhini, everybody now knows from the Dr. Deshpande, Arogyavardhini contain 50% Kutaki is the name of the herbal, that is a Picroheza Kuro, and this is the best medicine to stimulate all the liver functions. And the main function of the liver is metabolism of the proteins, metabolism of the carbohydrate, metabolism of the fats. According to Ayurveda, this is the chief site of Dhatvagni. So all the tissue metabolic process are always concerned with the liver metabolism. So when your liver is strong, your all the digestion problems will be solved. So Arogyavardhini will give you the best rasayana, best tonic for the liver. This is best medicine also for jaundice. 2 tablets 3 times in a day. Kumariyasava, that is aloe vera. Aloe vera is another medicine which acts on the liver. Aloe vera, there are 2 types, number 1 and number 3. One is a copper processed and another is a tamra sanskar rahita. That is a softer variety. Kumariyasava number 3 for the children. Kumariyasava number 1 for the adult. 4 teaspoons with equal amount of water after meals. After that, you can give another prescription, that is a Shankhavati, 2 tablets 3 times in a day with Jirakadirishta or Jirakarishta, 4 teaspoons with equal amount of water 3 times in a day. This is Jiraka is a Deepana Pachana, carminative and appetizer. Kuttajarishta, it controlling the watery part of your loose motions. Whenever there is a loose motion, better way use the Kuttaja. Interesting thing is that Kuttaja, this is medicinal plant having the Latin name. Try to understand. Holarhina antidysenterica. Holarhina antidysenterica. So Kuttaja is the best medicine for loose motion, especially Atisar or Pravahika. So Kuttajarishta, Kuttaja Parpativati, Kuttaja Ghanavati, anything you can use. 4 teaspoons with equal amount of water 3 times in a day. Then Pathyapathya, proper hygiene. As I am repeatedly telling you, boiled 20-minute boiled water is very essential to drink by these patients. Wash all the fruits and vegetables before use. Avoid eating out, visiting the hotels and impure water. Now we will talk about the gallbladder pain or biliary colic. That is that central upper abdominal part or middle part. Gallbladder is a bag which collects the bile, and bile is a secretion of liver, and bile is very essential for the fat digestion, because lipase cannot act without this particular bile. Bile also contains the cholesterol. Do you understand? So bile, when that bile is gallbladder, there is a liquid and some cholesterol material. So when this bile is more and more hardening or more having a solidification, then that particular called as a stone. So gallbladder stone means the bile stones. This gives the biliary colic, severe spasmodic pain. Try to understand. Severe spasmodic pain. And in addition to that, there may be little bit vomiting and little bit mild fever. So here you can use the Dudhpapeshwar capsule Vim Live. Capsule Vim Live, 2 capsules 2 times in a day after meals. Then Kanak Sundara Rasa, 1 tablet 3 times in a day. Then Sharapunkha, very specific medicine to scratch out that solidified bile. It breaks out the fragments of that cells, the stones, and that immediately thrown away through that gallbladder and enters into the duodenum and passes with the stool and all these things. So Sharapunkha tablet from Simco company, 250 milligram 3 times in a day, very specific medicine for these particular bile stones. Kumariaso for liver, number 1, 4 teaspoons with equal amount of water. Abhaya Rishta, there must be proper laxative, because peristaltic movements becomes normalized, Vatanulovana Prakriya takes place and pain gets relieved. Another prescription, Chandraprabha tablet, 1 tablet which contains the Shilajita. Then Shankhavati, best digestive or carminative, 1 tablet 2 times in a day, with Kanakasundara Rasa, 1 tablet 3 times in a day. My dear friends, in addition to this, you have to do some Pathya, for example, preventive measures. How you can prevent this particular stagnation or the solidification of bile. Number 1, your proper liver functioning is very essential to form the proper composition of bile. For that, you stimulate the liver function by Arogyavardhini, which contains 50% Ku Turkey, Picrorhiza Kuro, 2 tablets 3 times in a day. Shuddha Shilajit, 200 milligram plus Sharapunkha Ghana, Sharapunkha Ghana, 200 milligram plus Kanakasundara, 250 milligram 3 times in a day. In addition to that, aloe vera, Kumariaso number 1, 4 teaspoons with equal amount of water 2 times a day. TTK company, Tafroli, now tablet name, 2 tablets 3 times in a day, or in spite of the Tafroli, you can use the Vimliu from Sri Dudhpapeshwar company. Okay. Now, regimen, Pathya for the bile stones, stay away from the heavy, oily and spicy food. Most important is oily, fatty food, because bile is helping for digestion. Bile is not an enzyme, but bile helps for the lipase enzyme to act more properly, and it liquefies the disintegrate the fatty globules or fat molecules. So you have to, when there is a damage to the liver, when there is damage to the gallbladder, bile, then you have to always careful for the oily or the fatty food. Eat as per the digestion. Next, we will go for the another disease which is called as a very common disease, irritable bowel syndrome, or any spasmodic pain like splenic spasm or the hepatic flexure spasm of the large intestine. So here you have to give antispasmodic, which contains that particular aromatic oil is present in the lashun or the garlic. Lashun or garlic contains aromatic oil which is antispasmodic in action. Okay, and also digestant. So Lashunadivati 2 tablets 3 times in a day. Khurasani ova as a tranquilizer, 30 milligram plus Kuda 200 milligram 3 times in a day. Agni Tundi Vati 1 to 2 tablets 3 times in a day. In these cases, avoid eating outside oily, spicy bakery products and hotel products. Train yourself to handle the stress. Stress management is very important because this is a psychosomatic type of problem. Anger, fear, jealousy, and always remain to be happy. Eat as per your hunger and digestion, not because you got the time. Because many people say, no, I have the time at this time, so I will get eat and then I will forget lunchtime and dinner time. That is not true. Lunchtime and dinner time should be maintained very properly. It should not depend on your business or the occupation. Okay. Next, we will discuss about the acidity or peptic ulcer syndrome. Acidity or peptic ulcer syndrome related with the especially stomach and the duodenum. First, there will be gastritis because of the habit of eating very, very spicy, pungent food all the time, vada pav and fast food. That can irritation. Also, some medicines like, for example, aspirin, combiflam, any acids, non-steroidal anti-inflammatory drugs, which relieves your pain, that can cause irritation of the gastric mucosa. Remember this thing. And the most dangerous is alcohol. Alcohol can cause a lot and lot bad problem for your stomach and duodenum. Okay, so here all these cases you have to do the anti-pitta treatment because this is pitta problem. But pitta is of two types. Remember my words. One is a sama pitta and another is a nirama pitta. If acidity are coming after indigestion, the people has a constipation, patient has a gas, and then he has acidity, that is called as a sama pitta. But stools are normal, appetite is very good, no gas in the stomach, only burning sensation in the stomach and retrosternal burning, little bit nausea and vomiting, then that is called as a nirama pitta, amla pitta. So amla pitta can be divided into two, sama amla pitta and nirama amla pitta. Remember this thing. So calciprite, Ayurveda Rasashala Pune, 2 tablets 3 times in a day with lemon juice. Shuktin, Allersin Company, 2 tablets 3 times in a day. Shatavari Kalpa, antacid in Ayurveda, 2 teaspoons 2 times in a day with milk. Bhunimbadi Kadha, very interesting. Bhunimbadi Kadha, 4 teaspoons with equal amount of water. Avipattikar Churna as a laxative. Because Ayurvedic best treatment for Ayurveda Pitta is a Virechana Chikitsa. Remember this word. Pitta, heat of the Pitta is always removed out with the stools. So if you are a constipation, your acidity will not be get cured. You must have the normal and proper stools in the morning. Then only your acidity will be reduced. Ayurveda gives a lot of importance for proper stools. Remember. Avipattikar Churna, then Laghu Suta Shekhara Rasa, 2 tablets 3 times in a day. Kama Dudhavati from Hari Parshuram Aushadale, Pune Pharmacy of Khadiwale Vaidya, 2 tablets 3 times in a day. Amla Pitta Vati of Hari Parshuram Aushadale, 2 tablets 3 times in a day. Not all these medicines we have to use, but this is a little bit exhaustive list of the medicines. The doctor will select the proper 1 or 2 or 3 medicines from this particular list. Then Goraksha Chinchavale from Hari Parshuram Aushadale, Pune Pharmacy of Khadiwale Vaidya, 2 teaspoons of 2 times in a day. Then Shatavari Kalpa, 2 teaspoons 2 times in a day. I think it is already given over there. It is, sorry, this is repeated. Then Mahatiktaka Ghrita, 4 teaspoons 2 times in a day with warm milk. Okay. Then I will go for the next page. Okay. Amla Pittantak Yoga. This is another tablet from Baidyanath Company, the liquid, 4 tablespoons 2 times in a day. Or Pravala Panchamrut, 2 tablets 3 times in a day. Then there is a Charak company which gives the Ulcerex. Name itself suggests Ulcerex. It's acting on the ulcers, 2 teaspoons 4 times in a day. Or in spite of that, you can have another prescription, Mauktika Bhasma, Ayurveda Seva Sangha Nashik, 50 to 100 milligram 3 times in a day. Then Shankha Bhasma, 500 milligram 3 times in a day with milk. Then Swarna Makshika Bhasma, when there is an anemic condition, 500 milligram 3 times in a day. Another prescription, my dear friends, Dadimava Leh, here you can see another prescription, Dadimava Leh, pomegranate, jam of pomegranate, Ayurveda Seva Sangha Nashik, 2 teaspoons 3 times in a day. Gudvela Sattva, Guduchi, Tinospora cordifolia. This is a Pitta Nashak because it is a bitter in taste. Then Amlovin tablet is there, 2 tablets 3 times in a day. For this, you have to be very careful about Pathya. Avoid the spicy, oily, and pungent things. This is the first thing. Stay away from pickles, fermented items like idli dosa, bread, etc. Keep away from alcohol, no tobacco, no cigarette. Prefer milk instead of the tea. Munga dal instead of the tur dal. This is very important suggestion by Ayurveda. Green gram is better than turichi dal. Okay. Proper training to stay away from stress, that is stress management, and try to remain contented or happy. Now, last in this particular video is about the treatment of worms, roundworm, threadworm, hookworm, tapeworm, okay, or even the amoebiasis and giardiasis. You have to check the stools for that matter. Krumi Mudgara Rasa, 2 tablets 3 times. Ayurvedic word is krumi. Krumi is worms or any organism, parasites. Lashunadi Vati, as I have told you, antispasmodic, 1 tablet 3 times in a day. Vidanga Arisht, Vauding Vidanga is a very specific medicine for the worms. 4 teaspoons with equal amount of water 2 times in a day. Another prescription, Vidanga powder, 200 milligram 3 times in a day. Bhallataka sav. But be careful in the pitta dominant people. Don't use the bhallataka. If there is a bleeding, if there is ulcer, don't use bhallataka. Semecarpus anacardium. Okay. Then there is a Shatapal Kada or the Satapa Kada. I'm sorry, Satapa Kada. Not Shatpala. Satapa Kada is very specific for worms. That is also available from Hari Parushuram Aushadhalaya. That is a pharmacy in Pune from Khadiwale Vaidya, very famous Vaidya. 3 teaspoons with equal amount of water 2 times after meals. So my dear friends, in the second part of pain in abdomen, we have discussed about amoebiasis, biliary colic, biliary irritable bowel syndrome, and also acidity, and also last worms. So I hope that you are enjoying the education regarding the systematic education, scientific education, but in a simple language about the many diseases that we come across in our society. Okay. So thank you very much. Don't forget to subscribe my YouTube channel and see you in the next video. Till then, स्वस्थ रहिए, खुश रहिए. I wish all the best. Take care and see you soon.